Every 30 seconds, someone takes their own life. 30 to 70% of suicide victims suffer from major depression or manic depression disorder. 5% of all teens suffer from depression, yet only 20% are appropriately diagnosed. I spent a large part of my life contemplating psychology and mental health issues. 1 in 5 people suffer from depression. It is the leading cause of death among children and adolescents aged 10 to 24. It is also the world's leading cause in disability, and yet 50% of people who suffer from depression are appropriately diagnosed. 40 to 60 people out of 100 who use antidepressants saw improvement within 6 to 8 weeks. Psychotherapy has a significantly lower relapse rate rather than medication. Other treatment options include light therapy, magnetic stimulation, and ECT. The steps to recovery are recognition, learning your triggers, and integrating healthy changes into your life at your own pace. A lot of symptoms with depression are very sneaky, and they're not physical symptoms, so they're very hard to place. Loss of interest, excessive sleeping and eating, lack of appetite, irritability, excessive crying, thoughts of suicide. The risk factors are also very hard to spot, which include lack of social support, relationship problems, financial strain, alcohol and drug abuse, unemployment. Depression is a sneaky monster because there are many different types of depression, including major depression, which affects more than 3 million Americans a year. You have persistent depressive disorder, which also affects over 3 million Americans a year. It could last a lifetime. It normally lasts years, and atypical depression affects over 200,000 people a year. It can last a lifetime as well. It needs to be diagnosed by a medical professional. Bipolar disorder is very serious. It is a chronic disorder, and it is oftentimes overused and romanticized, yet it is a chronic disorder and should not be. Premenstrual dysphoric disorder is a severe form of PMS that can last a lifetime, that cannot last a lifetime, it can last years. You also have postpartum depression. 1 in 8 women go through postpartum depression, and it normally lasts a few months with the help of a physician. It affects 1 in 8 mothers. Situational depression occurs when somebody has trouble dealing with the effects of life changes. Depression is a very sneaky illness because the risk factors vary, because the symptoms vary, because there are many different types that vary, and the symptoms vary per type of depression. If you have depression, do not feel lost, do not feel disconnected. It is hard to spot, and it's very important that we focus on the people who do suffer from these type of mental illnesses, and that they get the support that they need to reach out to others and feel more comfortable, and the stigma is erased in mental illnesses so that they can feel more comfortable to come out to places and to speak to physicians. And it's important that we as people do not stigmatize these type of things and don't hinder their recovery. Thank you.
Thank you.